Earlier, I spoke to Stephen Dorrell, former Conservative Health Secretary under John Major, a former chair of the Health Select Committee. He's now a Liberal Democrat. And Dr. Jacky Davis, co-founder of Keep Our NHS Public, who's a member of the British Medical Council and author of NHS Under Siege. I began by asking Stephen what he made of Wes Streeting's plans.
I think it'd be hard, frankly, to find anything that he said, and I've read his speech reasonably carefully, that I couldn't have said when I was in the past a Conservative Health Secretary. I'm no longer a Conservative, but I agree with a huge amount of what he said. And I guess the one thing that I think I would have given more emphasis to is the importance of joining up the health and social care systems and not seeing the NHS as somehow something separate from the rest of health and care and indeed wider public services.
Jacky, let me ask you then for your take on what Wes Streeting was talking about today.
Well, it's very interesting, with all due respect to my colleague, that he feels that he could have given the same speech, because I think there will be many waiting for Labour to get into power who were disappointed with what they heard today. Firstly, that he hasn't really identified the big problems of the NHS, which are chronic underfunding for the last 13 years and a massive problem with understaffing at the moment, and told us how he's going to address those. And that he's really focused on two things which are just a kind of lazy way out of some politicians who don't know what they're going to do, one of which is this rather sort of amorphous reform. And one of the things the NHS doesn't need is another disorganisation. It's had one every 2 years and things get worse every time. And focusing on technology, which of course the NHS needs, but is not the answer to anything. It desperately needs funding. It desperately needs addressing the staff problem at the moment. And neither of those things really came out today. There were some things to welcome, I have to say, but the two big things that need to be done weren't addressed, and we were offered something that the NHS needs, quite frankly, like a hole in the head, which is another reform.
Well, I think Wes Streeting was making it clear he wasn't talking about structural reform so much of the way the NHS works. But I mean, Stephen, what was your understanding of what he did mean by reform? Because it seemed a bit difficult to assess what the big difference was going to be beyond, as Jacky was saying, the use of new technology, which is something that the NHS is already at least working on.
Well, the NHS, of course, seeks to adopt new technology and apply it as part of normal business. So I agree. I actually agreed with most of what Jacky said as well just now. What I think is, what does Wes Streeting mean by reform? I think he means actually walking the walk rather than just talking the talk, of shifting resource into prevention, early intervention, keeping people out of hospital when they don't need to be there. It's why when you asked me in the first question how I react, the thing that I think needs to be re-emphasized is the importance not just of the hospital system and the GP system, both of which are vital, but also of the links between those systems and social care and social housing. All of those things are part of the support mechanisms that we need for a system that needs to move away from waiting for people to be ill and look for opportunities to prevent them being ill.
Prevention clearly is a good thing, isn't it, Jacky? And Wes Streeting was saying that he wanted children born under Labour to be the healthiest ever. But when you bear down into what he was talking about, well, a few more breakfast clubs in school, a bit more focus on mental health in schools and getting kids to brush their teeth at school.
All of those things, of course, are highly welcome, but the huge issues not addressed as far as we're concerned, I think. Yes, of course, Stephen's absolutely right. You know, prevention's always been very important, but at the same time, not before, but at the same time as you're looking at, you know, stopping people getting into hospital in the first place. Yeah, I've worked in the NHS all my life as a doctor. I know that there's a certain percentage of people are going to end up in hospital regardless of you know, how good you make preventative care. We haven't got enough beds in hospital. We've got, at one stage, Royal College of Emergency Medicine thinking 500 people a week were dying because they couldn't get into a hospital bed out of the back of an ambulance. That's social murder by any measure. That's absolutely shocking. So while all these aspirational hopes are very good, what we really need at the moment is for a Labour politician like Wes Streeting to stand up and say how he's going to address the massive problems, one of which is a hemorrhaging of staff out of the organisation. They're burnt out. They were burnt out before the pandemic, and they're even more burnt out at this stage. We need recruitment and retention plans. He talked about those for social care staff, and I absolutely agree that the two services need to be brought together. Didn't talk about that for the NHS staff, didn't say how he was going to deal with the pay disputes that are going on at the moment. He didn't talk, he said, I think I'm going to quote him here, reform is more important than investment. It really isn't. There's nothing the matter with the model of the NHS. If it were funded to the same level of comparable healthcare systems, such as France and Germany, we would have what we used to have, which is a world-beating NHS. But he didn't talk about those things. He rather sort of nibbled around the edge. And I think many people are going to be disappointed by that from a would-be Labour Health Secretary of State for Health.
Yeah, I mean, Stephen, he didn't seem to have any real solutions to those huge problems of 7.7 million people on waiting lists. And many of those people, of course, will end up with more serious problems because of the delays. And the workforce problem, hospitals desperately short of staff, and then you throw in the disputes, which is just making the waiting lists worse.
Can I pick up the workforce issue, because Jacky's focused on that, and I agreed with everything she said about it. And Wes Streeting was critical. I think rightly, I've been very critical myself of the way ministers have frankly scapegoated doctors, and it's been a convenient distraction to be able to say, well, waiting lists are in some sense the result of disputes with not just doctors, but across the clinical professions going on over 12 months. I think the government is open to very serious criticism for not having prioritised settling the pay disputes months and months and months ago in order to focus on bringing down waiting lists, improving access to to A&E departments, emergency wards in hospitals, but also, again, I say it, shifting resource in order to focus on avoiding admissions in those cases where you can avoid them. Of course, it's true, Jacky says, that some people will always end up in hospital. But nobody should be there if they didn't need to be there. They don't want to be. Nobody wants to be there. And if our system worked better, there are people now who are waiting to get into emergency access to hospital for whom that was unnecessary if our system worked better.
Do you think, though, Jacky, that Wes Streeting had a point when he talked about the need to look beyond that principle of the NHS being a publicly funded public service, free at the point of use, but perhaps to be using the private sector more to try to tackle those terrible waiting lists?
I think that it depends on the way that you use the private sector. And what's happened in the past, both under Labour previously and, of course, under the 13 years of the Tory government, is that the private sector has been set up in competition with the NHS, and it's been incredibly unhelpful for patients. It's wasted a great deal of money, and a huge amount of bureaucracy has been involved. So I don't think the private sector the NHS isn't going to start making its own wheelchairs, for instance. The private sector will always be there, but it has to be there to support the NHS. So I think that's a really important point about the private sector. The other thing is that the people who work in the private sector are actually mostly NHS staff. So if you use the private sector, you're using the staff in a different place and paying more for it. It would be much better to say we're going to pay NHS staff properly, we're going to recognise their worth, and he paid a bit of lip service to that today, but didn't really hear him put his heart into it. And we are going to, in that way, we will get more people to come and work for the NHS. We'll make it a very attractive employer. And we won't have to use the private sector as much as we have, and we certainly won't use it to compete with the NHS. It'll be there to support it. And our feeling is that if you funded the NHS to the level that other comparable health services are funded, you would not need to use it except peripherally as a support for the NHS.